The biggest weight loss and diabetes drugs on the planet right now, Ozempic and its cousins, began somewhere no one would ever guess. Not in a shiny lab, not in a rare plant, but in the venomous bite of a slow, chubby desert lizard. This is the strange, true story of how a monster's venom became modern medicine. Meet the Gila monster, a heavy, orange and black beaded lizard from the deserts of the American Southwest. It is one of the very few venomous lizards on Earth. It moves in slow motion, and it has one truly unusual trick. It can eat just a handful of large meals in an entire year, then live off its stores in between. Back in the 1980s, scientists noticed something strange. Venom from certain lizards and snakes made the pancreas, the organ that controls your blood sugar, grow larger. Something inside that venom was speaking directly to the body's sugar system. The question was, what exactly was the message, and could we ever learn to use it? For years, that question sat unanswered, a tantalizing clue with no one willing to chase it down. Enter Dr. John Eng, an endocrinologist working quietly at a veterans hospital in the Bronx. He was curious, stubborn, and working on a shoestring budget with borrowed time. He had a hunch that a brand new hormone was hiding somewhere inside that lizard venom, waiting for someone patient enough to find it. So in 1992, using a clever chemical test he had helped develop, Eng went hunting through the venom of the Gila monster, molecule by molecule. And there, at last, he found it. A brand new peptide, a tiny chain of amino acids, which he named exendin 4. Here is where the story turns beautiful. Exendin 4 looked and behaved a lot like a hormone we make in our own gut, called GLP-1. In other words, this strange desert lizard was quietly carrying a near copy of one of our own body's signals. So what does GLP-1 actually do for us? After you eat, your gut releases it, and it does 3 clever things at once. It tells your pancreas to release insulin, it sends your brain the message that you are full, and it slows down how fast food leaves your stomach. That sounds like the perfect treatment for both diabetes and overeating. There was just one enormous problem. Our own natural GLP-1 is fragile. The body chews it up and destroys it in about 2 minutes. Far too fast to ever work as a real medicine. But the lizard's version was built completely differently. Exendin 4 shrugged off that rapid breakdown and kept working for hours. And it makes perfect sense. A creature that only eats a few times a year needs a long, slow, steady hormone signal, not one that flickers out in minutes. Eng understood exactly what he was holding. A stable, long-lasting version of a human hormone that could potentially treat diabetes in millions of people. It was a genuinely huge idea. But when he brought it to his own institution, they shrugged, were not interested, and let the patent quietly lapse. So Dr. John Eng did something remarkable. He patented the discovery himself, paying for it out of his own pocket. Then, to get anyone in the industry to even notice, he rented a tiny booth at a big diabetes conference and personally pitched his lizard peptide to whoever happened to walk by. Finally, a small biotech company called Amylin took a chance on him. They turned exendin 4 into a real drug called exenatide, sold under the name Byetta. And in 2005, the Food and Drug Administration approved it. The first medicine of its kind, straight from lizard venom to the pharmacy shelf. In 2013, the discovery won a Golden Goose Award, a prize that celebrates strange, curiosity-driven science that ends up quietly changing the world. A lizard almost nobody had ever cared about had just launched a medical revolution, led by one stubborn doctor who refused to give up. Because that single peptide threw open the floodgates, drug companies raced to design better, stronger, longer-lasting versions built on exactly the same idea. And over the next 15 years, they got very, very good at it. The lizard had handed them the blueprint. What had started as one lizard, one doctor, and one lapsed patent was about to become a global industry. Novo Nordisk released Victoza in 2010. Then, in 2017, came semaglutide, the drug you now know as Ozempic and Wegovy. Soon after came tirzepatide, sold as Mounjaro. Each new version was more powerful and longer lasting than the one before it. And these newer drugs did something that stunned even the scientists who made them. At higher doses, people did not just steady their blood sugar. They lost serious, life-changing amounts of weight. The humble lizard hormone had become the single biggest story in all of medicine. So how do these drugs actually work? This is the honest part that most advertisements skip right over. They are not fat burners. They do not secretly rev up your metabolism or melt fat while you sleep. The real truth is simpler and far more interesting. And once you understand it, you will never look at the ads the same way again. They work mainly by quieting your appetite. In your brain, they turn down the hunger signal. In your gut, they slow your stomach so you feel full sooner and eat less at every meal. Less hunger, less food, and so less weight. That, at its core, is the real mechanism. And the numbers are genuinely striking. Semaglutide leads to around 15% body weight loss on average. The newer tirzepatide reaches around 20%. And retatrutide, still working its way through clinical trials, has hit up to about 24%, numbers we have never seen before from a simple injection. Our own research library digs into exactly why this happens. The newest drug, retatrutide, hits 3 different body targets at the same time. And across the studies, the weight loss is driven by people simply eating less, not by burning more energy. It is appetite control, turned all the way up to the maximum. But there are real catches here, and you truly deserve to hear all of them. When people stop taking these drugs, the appetite comes roaring straight back, and much of the lost weight very often returns. They manage a condition. They do not cure it. On top of that, some of the weight people lose is muscle, not just fat, and that matters more and more as you get older. There can be nausea and other side effects. And the price tag is steep. So, powerful, absolutely. Magic, definitely not. So the honest verdict comes down to this. These are genuinely remarkable drugs, a real and serious tool that works while you take it, especially alongside good food and regular movement. But they are not a magic shortcut that you finish once and then forget all about. Still, just step back and marvel for a moment. A shy, slow, chubby desert lizard, biting only to defend itself and survive, happened to carry inside it a single molecule that would go on to reshape the health of millions of people all around the world. Nature, it turns out, had the idea first, all along. The scientists just had to be curious enough to go looking in a very strange place, and stubborn enough to chase it down when almost nobody else believed. That, really, is the whole story of discovery. I am Pip. Follow Second Opinion, where we dig into the research and give you the honest version, the wins and the catches both, so you do not have to. Because the truth is usually far more interesting than the hype.